What you don't know about your current Medicare insurance plan could hurt you significantly. Hi, my name is Christopher Westfall. I'm a specialist in the Medicare insurance world, and today I'm reviewing a recent article from Modern Healthcare, printed in black and white to conserve ink. This, from the August 13th edition, is something that is striking because we help people with Medicare insurance all the time, and they don't know sometimes when they come to us and they've been on a plan that they expected to get health care from, all of a sudden to find out that it's not approved. What do you mean it's not approved? Well, if you're in a certain type of health insurance, certain type of Medicare insurance to be specific, everything you have done, every procedure, outpatient, inpatient, all of it has to be approved by somebody else, a medical director, and some guidelines that are ever shifting. They're changing. They're not always the same. Conversely, if you're on a Medicare Supplement plan, which we do 90% of in my office, a Medicare Supplement plan does not have to have these kinds of pre-authorizations, pre-approvals. Well, what does that mean? People on a Medicare Advantage plan are often paying $0 per month, no premium whatsoever, and those savings have to account for something, right? Well, let's look into that, if you'll bear with me. The article says, hospitals call for overhauling Medicare Advantage prior authorization rules. We're talking about Medicare Advantage specifically. Going to hit some highlights of this article. I'll put the link to it here in the video and also in the description below. The highlight is, in response to the Trump administration's request for information on its Patients Over Paperwork initiative to cut Medicare red tape, bravo, hospitals have complained that prior authorization is a complicated system where payments are not guaranteed, even if they follow all the steps the insurers, Medicare Advantage, lay out for them. They want a national standard so that clinicians know exactly what they have to do to get treatments approved regardless of the insurer and ensure that they get paid. Highlighted portion here, quote, you follow the payer's rules, you think, wow, that was an easy process. You thought you checked all the boxes to get the procedure paid for, only to be denied, wrote Lori Pierce, Director of Patient Financial Services for a 25-bed North Valley Hospital in Montana. She complained that the appeals process is burdensome, Medicare Advantage. On average, she has to appeal an unpaid Medicare Advantage claim at least 3 times to get paid. Even if an appeal is successful, it can still take 6 months to get paid, she noted. Now, this is the problem. So you have hospitals and caregivers on one side. They want the best thing for their patients, and their agents do too. They want things to go smoothly with the insurance that they've sold to their senior client. Then on the other hand, you have the insurance companies who, on the managed care side, Medicare Advantage, the managed care side, are doing everything that they can to manage dollars to keep the dollar outflow low because they're paid a capitation rate typically, which means the government pays them so much per member per month, regardless of the amount of care that they give. Here's another quote. The hospital insurer battle between hospital and insurer over prior authorization has simmered for years. But this year, it has been highlighted for an issue for congressional lawmakers by provider lobbyists. Washington is notorious for their lobbyists, especially in the insurance world, but here we have provider lobbyists, that's the hospital groups, doctor groups, pitted against the insurance company. This will get interesting. Insurers are watching for how any potential regulatory changes could affect them, the insurance company. As the Blue Cross and Blue Shield Association made clear in its own comment letter to CMS, Center for Medicare Services, the group argued against standardization of prior authorization procedures. The group argued against standardization, which it claims could undermine how insurers tailor their coverage for specific patient groups. Quote, while we support the goal of reducing provider burden and improving interoperability, we caution against efforts to standardize criteria across the industry. Blue's Vice President of Policy Chris Haltmeyer wrote, quote, standardization could end practices supporting appropriate variations in member populations. What does that mean? Let's just keep it muddy so that nobody has a clear guide as to what will get approved and what won't when it comes to getting patients approved for prior authorizations for procedures they need. When Haltmeyer acknowledged hospitals' disgruntlement over the current prior authorization process, he defended the process as one of, quote, the most important tools plans use to promote safe, effective, and lower cost treatments. That's the goal, folks. The Blue Cross and Blue Shield Association, America's Health Insurance Plans, that's AHIP, the American Hospital Association, the American Medical Association, and the Medical Group Management Association have all joined forces to discuss prior authorization issues. Yeah, so let's see what they're actually doing about it. This article came out about a bill that's currently stalled in the United States House. Interesting as it is, in this very heated political climate of red versus blue and the House being leaning all Democrat, the problem is being addressed in this particular bill, which can't even get to committee, by Republicans and Democrats. The co-sponsors are equal on both sides. The article from Healthcare and Politics says, the American College of Rheumatology has applauded a proposed federal bill that would amend the Social Security Act, that's where Medicare is funded, to regulate the use of prior authorization for patients with Medicare Advantage plans. The title of the story says, proposed legislation could eliminate prior authorization hurdles in Medicare Advantage. The bill, H.R. 3107, was introduced in the House and referred to the Ways and Means Committee. By the way, it never arrived. This article from June 7, 2019. It is sponsored by Representative Susan Delbene, Democrat, Washington, and co-sponsored by Representatives Mike Kelly, Republican, Pennsylvania, Roger Marshall, Republican, Kansas, and Amy Barra, Democrat, California. Again, even on both sides of the aisle. Quote from the article, for far too long, patients have faced unnecessary and unreasonable care delays due to insurers' overzealous use of prior authorization. We're talking about Medicare Advantage still. Says Dr. Paula Marchetta, president of the ACR, that's the American College of Rheumatology. She said in a press release, quote, this practice creates significant burdens for physicians and can put patients' health in jeopardy. We applaud congressional leaders for standing up to ensure America's Medicare beneficiaries are able to get the care they need and deserve. According to the ACR, the bill would, among other things, establish a process so that real-time decisions could be made regarding services that are routinely approved anyway. In addition, the legislation would require Medicare Advantage plans to offer an electronic prior authorization process. Imagine that. Not faxing handwritten scribe back and forth that they can't read. Require Medicare Advantage plans to offer electronic prior authorization process and to report to CMS the extent of their use of prior authorization, as well as how often they approve or deny medications and services. This is going to be good. I got something coming up to show you about that, what CMS has already been directed to do. She goes on, quote, while originally intended to control costs by reducing unnecessary tests and procedures, many health plans are now indiscriminately using prior authorization, creating additional hurdles for patients and physicians that can lead to delays in treatment that may endanger patients' health, the ACR wrote in the release. The process for obtaining this approval can be lengthy and typically requires a physician or their staff to spend many hours negotiating with the insurance companies, time that could be better spent taking care of patients. Again, we're talking about Medicare Advantage. It goes on. The Regulatory Relief Coalition recently released a national survey, this is really good, of 1,600 physicians in which 87% of these physicians reported that prior authorization has had a significant or negative impact on their patient clinical outcomes. 87% of doctors are saying this about their Medicare Advantage plans they're working with. Quote, nearly a third of physicians surveyed said their patients often abandon treatment due to prior authorization. Furthermore, 84% of survey respondents said that the regulatory burdens associated with prior authorization and Medicare Advantage has significantly increased over the past 5 years, with half of all practices reporting 11 or more requests per week. Back and forth, back and forth. My friend Susan, agent in California, reminded me we recently did a video about this. This was big news the end of 2018. This is an Office of Inspector General report on Medicare Advantage appeal outcomes and audit findings raise concern. This is huge. I'm going to link again in the video that we did about this report when it first came out, because it's important that you stay up to date on what's happening with Medicare if you are indeed a Medicare beneficiary or you're going to become one. Becoming an advocate for seniors is what I do, so you should really subscribe to this channel, see what's new. This is a summary of the entire report, which is pretty dang thick here. 30, 39, 50, 40 something pages. So let me just read to you the summary of the report about Medicare Advantage, right? This is from the Office of Inspector General, U.S. Department of Health and Human Services. They are over all this stuff, and they told CMS to get off their butt and fix this, but this is what the OIG found. Sorry, I digress. Here's the quote. When beneficiaries and providers appealed pre-authorization and payment denials, Medicare Advantage organization overturned 75% of their own denials in 2014 through 16 throughout this study, overturning approximately 216,000 denials each year. Let me just stop for a minute. Let me start over again. When beneficiaries and providers appealed the pre-authorization denials, so you need something done, right? And your doctor or you go to the insurance company and say, hey, I'm scheduled for this procedure to be done in the hospital or this procedure to be done outpatient. Denied, instantly denied in most of these cases. If they appealed it, even at the first level, as many as 75% of them are, oh, yeah, we denied that. We didn't mean to do that. Sorry. Yeah, we just needed some clarification on that. But what this report shows is that 1% of the denials are where people will actually stand up for themselves and even go to the very first level of appeal when they're shot down by a Medicare Advantage company. So my overall message to you is this. If you're going to choose a Medicare Advantage company for your Medicare insurance, as you're going to be 65 through the end of time, for heaven's sake, understand that this is routine. This is how the plans save money. This is how they do it, by routinely denying care. Even a pre-authorization to go get a surgery or to go get a procedure done. And less than 2%, just around 1% of the people even speak up for themselves and appeal it. And this report says that many of the reasons why these people are critically ill, they need this stuff done. The doctor says, yes, you need it done. They refer to a specialist. Specialist says, yes, you need it done. And guess what? Denied. So then they go and appeal it. 75% of them are approved at the appeal level, but who's got the time to go and fight with an insurance company for something? Sometimes you get what you pay for. That's my only point. It says down here again, pick up the quote. During 2014 to 2016, beneficiaries and providers appealed only, not me saying it, appealed only 1% of denials to the first level of appeal. Only 1% of people are sticking up for themselves. The Center for Medicare and Medicaid Services, CMS, audits highlight widespread and persistent Medicare Advantage performance problems related to denials of care and payment. For example, in 2015, CMS cited 56% of audited contracts for Medicare Advantage for making inappropriate denials. 56%, and that's just in the ones that were audited. They can't audit every one of them. CMS also cited 45% of contracts for sending denial letters with incomplete or incorrect information, which may inhibit beneficiaries and providers' ability to file a successful appeal. So when they are denied, 45% of the time, the letters that the person got denying the coverage or denying the plan of action did not even specify why it's being denied. In response to these audit findings, CMS took enforcement actions against these Medicare Advantage organizations, including issuing penalties and imposing sanctions. Because CMS continues to see the same type of violations every year in its audit with different Medicare Advantage organizations, however, more action is needed to address these critical issues. Why did the Office of Inspector General do this review? And here it is. A central concern about the capitated payment model used in Medicare Advantage is the potential incentive for Medicare Advantage organizations to inappropriately deny care to services and payment in an attempt to increase their profits. That's not Chris Westfall saying it. That's not me. It's right there. To increase their profits. I'll just read with you. A Medicare Advantage organization that inappropriately denies authorization of services for beneficiaries or payments to healthcare providers may contribute to physical or financial harm and also misuses the Medicare program's dollars that CMS paid for beneficiary healthcare. More than half the beneficiaries today are signing up for a free or zero premium Medicare Advantage plan. It's my humble opinion, having worked with seniors now for 20 years, been licensed for 26 years in the insurance space, that they don't know what the hell they're signing up for in many cases. I'm sorry. This would have been looking a lot better had I printed it in color, but we're saving money around here because our money is your money. Of the successful appeals, fully successful appeals, when they just asked, why is this being denied? 70% right off the bat. Another 5% were partially successful, so something was approved. Unsuccessful, 25%. So here's the numbers again. 1% of the people are appealing at all, and when they do, 75% of them are getting a successful conclusion. Medicare Advantage denying care before the care can even be done. You know, this came forefront in my mind again this past week. I mean, I'm on an HMO, our employer plan here, with a $6,000 deductible. Yay! $6,000 deductible. And I needed some surgery on my wrists. So I called my insurance company. I said, hey, has the prior authorization been achieved on this procedure? And they said, well, that's up to your doctor to do. But if your doctor does not get prior authorization and you go ahead and have the surgery, we're not going to pay anything. So that is managed care. What they're managing is your care for the sole and express purpose. I pointed out 3 examples there of making more money by getting the same amount per member per month and paying out less as a systematic and an organized way of paying less for your health care. Now, this only was, according to their study, 50% of the Medicare Advantage organizations that they looked at, almost half, routinely denying care. So my question is, which one are you going to be in? Which time are you going to be affected by it if you're on a plan? And how important is it really that if you need a surgery, let's say you're in excruciating pain and you're having back pain and you need surgery for it, and your doctor and a specialist that they referred you to, because with those plans you got to get referrals first. You can't just go to a specialist like you could on original Medicare with a Medicare supplement. And they're going to deny that. And now you have to fight it. What happens while you're fighting an appeal? What happens when you're appealing to the next level? There are 4 levels of appeal with Medicare Advantage. I'll tell you what happens. You suffer in pain while they decide how far they can push this out until you finally give up. That's just my personal opinion after reading all the data. Let me give you a different perspective. Like I said, 90% of what we do in here is Medicare Supplement insurance. What's that? That's original Medicare, which is great insurance. The only thing wrong with it is it only pays 80% of your bills. Original Medicare, we couple with that, with my broken hand, a Medicare Supplement plan or Medigap plan, which fills in the holes that original Medicare does not cover. What does that leave you with? Freedom, flexibility. You can go to any doctor, any hospital, for any procedure covered by original Medicare. Now, yes, there are certain things that require prior authorization with Medicare. They include durable medical equipment, orthotics, like if you're going to get braces for your legs or you're going to need a wheelchair, you've got to get prior authorization for that, because the durable medical equipment industry is fraught with fraud everywhere in the Medicare world. So original Medicare has with it some protections in place. But I guarantee you this, if your doctor says you need a particular surgery and your doctor and your hospital accept original Medicare, it doesn't matter what name is on your Medicare supplement card, it's going to pay the other percentage of that that's not covered by original Medicare. Why? Because Medicare makes that determination as to whether it's medically necessary or not. Medicare is just straight up insurance. You have the procedure, it pays it. You have the procedure, it pays it. Doctors accept Medicare? Yeah, over 96% of doctors accept Medicare. Same with hospitals. So you can pick up, travel, go anywhere you want, go to the best treatment facility in the country, make an appointment, baby, because it's going to be paid for. And your supplement just follows right along, does not need prior authorization, does not need pre-approval on your Medicare supplement. If Medicare originally pays for it and Medicare says it's good with the Medicare supplement. Doesn't matter which company you have. What matters on selecting the company is your experience, hopefully that of your agent like we do, dealing with thousands of seniors. We know who's going to answer the phone if you call your Medicare supplement company. We know who's going to answer the phone in India or who's going to answer the phone in Dallas, Texas, for instance. Who's going to take care of you with fixing billing issues, things like that, which is really all we have to come up. Or who's going to, outsource that to a third-party administrator that just could not give a flip or not. So when we make a Medicare insurance recommendation, we do give all the available options. We'll show you Medicare Advantage. We'll show you Medicare Supplement. But I believe in full disclosure, and yes, I work in the insurance industry, that the insurance companies that are doing this to seniors laying their health care at the feet of the almighty dollar to get as much out of them as possible as they're being reimbursed from the government is just flat out wrong. Now, this bill, as I mentioned, as of the day of this recording, it's still stuck, not even getting into the Ways and Means Committee. It's not even in there yet. It's not on their schedule yet. And Nancy Pelosi, Speaker of the House, could, of course, fast-track that right to the front. But guess what? You've got two competing interests there. You've got the hospitals and doctors fighting, advocating for their patients. And on the other hand, you've got the insurance company trying to preserve, as long as they can, no oversight. Let's just leave prior authorizations ambiguous. Let's just leave it, muddy waters. No electronic method of getting it automatically paid. Because guess what? Every time something's automatically approved, instantly approved and paid and set up on the schedule, like, thank God, the doctor told me on Friday I needed this done. Had the surgery on Tuesday. I was in a lot of pain. It's like a tendon thing right in there. But if I had to go for weeks and weeks and weeks in appeal, I'd just give up with them and just pay for the stinking thing out of pocket. Some people can't just pay $10,000 out of pocket because their HMO says it's not going to be covered with us. And with a Medicare Advantage plan, you can't just step in and out of Medicare. No, for the contract year that you're on that Medicare Advantage plan, you are not participating in original Medicare, where you can just go into a doctor's office and say, here's my red, white, and blue Medicare card. I'll take you for this 80%. I'll just pay the 20% out of pocket. Doesn't work that way. When you sign up with a Medicare Advantage plan, from that January to that December 31st, you are on that plan, unless you move outside the service area or something drastic happens with the plan. Even losing your provider, let's say they designate you a primary care physician at the beginning of the year. If that doctor leaves the health plan, sorry, you're still stuck on the health plan. It's your contract, not his, that they care about. You're stuck on that plan until December 31st. And oh, by the way, if you sign up for a Medicare Supplement plan, last time, I'll get off my soapbox here in a minute. If you're on a Medicare Supplement plan, let's say you bought Plan F, let's say you bought Plan G, or you bought Plan J before 2010 when it went away. No matter what happens going forward, just like a life insurance contract, that cannot be canceled. Your benefits are a contractual obligation that cannot be phased out. You're grandfathered in no matter which plan you bought when you originally got on that Medicare Supplement plan. You can move from state to state and they can't cancel your coverage. They can't change the terms and what benefits or what's in that contract. However, count on this and take this to the bank. Your Medicare Advantage plan will absolutely positively change every single year. Your doctors can come and go, hospital network can come and go, and your benefits will definitely change. Last year we had a whole bunch of plans out there that offered silver sneakers with them. They don't this year. Why? Because it's not contractually guaranteed benefit. And if they can offer to drive you to your doctor today, guess what? They may take away that benefit next year. Every year around September, October, all those people in a Medicare Advantage plan or a Part D drug plan, because it's the same hierarchy, they're going to get an ANOC letter, Annual Notice of Change. You better look at that very carefully when you're selecting what plan you're going to be on for the next January, because that's your opportunity to look at what I had, now what they're requiring me to pay. Pay particular attention to the hospital out-of-pocket costs. And remember this, last note, those changes, those benefits that you see in your summary of benefits or your ANOC letter of your Medicare Advantage plans only will pay those benefits to the level that you fully participate in what's prior approved and what's inside their network at that time. What do I mean by that? Well, if your doctor was in the plan at the beginning of the year, but he's not in the plan as of June or July in the year, and you go to that doctor anyway, it's out of network. Guess what's covered out of network on an HMO plan that's not a true medical emergency at that time? Nothing. So yeah, you can choose to go Mayo Clinic or anywhere else you want to in the country using your Medicare Advantage plan. But when you find out that it's not in the network and it's not covered, you're going to be burdened with that 100% of the cost. Anything that's not approved by the Advantage plan, when you're on that contract with that Advantage plan, is your responsibility 100%. So you better get the prior authorization. But according to these studies, it's going to be slim pickings if you do. And you might have a good doctor like these, the one I'll show you, who go back and fight for you over and over and over again, hopefully while you're not suffering or you're in pain management, to try to get those things done where they'll actually fix your pain and get you on the way. But as for my mom, I've got her on a Medicare Supplement plan. Why? Because it's the best coverage you could have. And sometimes people can't get a Medicare supplement. I am fully aware of that. And that's why we offer Medicare Advantage too. For some people, it's the best thing for them. I just want you to know what we're seeing behind the scenes is every day I review everything new in the news and in Congress as it pertains to Medicare. And I feel it's my obligation to tell my clients and prospective clients, our service doesn't cost anything, by the way. We can help you at the 800 number below. It doesn't cost anything for our help. I just think that it's incumbent upon me in the Medicare space to be fully engaged every day, fully immersed in one thing and one thing only, that's Medicare. If there's one thing I know and keep up on, it's Medicare. So again, I suggest that you subscribe to this channel, hit that notification bell, because things are changing with our senior benefits, and I want to keep you fully apprised of it, whether you're our client or not, whether you want a second opinion on the plan that you have or not. Our services and my team in here doesn't cost a thing. We're paid by the insurance company if you sign up, and if not, we're happy to help. So God bless you in your Medicare journey. We're here to help you, and thanks for watching. Have a great day. Bye-bye.
Hi everyone, I'm Dr. Ratanya Carr. I'm a hepatologist at the University of Pennsylvania and an active member of the American Gastroenterological Association. I'm here on the Hill this week advocating for our patients. As we all know, this issue of prior authorization is really delaying very important high quality care for our patients, and we are here helping our congresspersons learn about HR 3107, which the AGA fully supports, to help our patients get rid of some of these loopholes in getting the timely quality care that they need. And this literally just happened yesterday while I'm here on the Hill trying to advocate for our patients. I get a call from my nurse if the patient I wanted directly admitted could not be admitted because guess what? Prior authorization procedure had not been followed. So that actually delayed hospitalization of my very sick liver patient for over 24 hours because of course by the time he was approved there were no beds available. This is directly impacting our patients' lives. It's of course impacting our lives. So please get involved and talk to your congresspersons.